Pleasant afternoon, everyone. Maayong hapon. I guess wala namang na halo sa atin, no? For parang mga ano lang, mga kalahi lang. So feel free lang, no? It's not a formal. Let's not make it a formal na discussion kasi mas maganda yung meron tayong interaction. I believe that you're also engaged with the development work, and I know that you can relate with this topic, no, because what I'm going to present this afternoon is the development framework of the National Nutrition Program, the blueprint of the National Nutrition Program in the country, which will cover different perspective, not only limited to nutrition security, but we will also touch strategies on food security as well as other interventions that will address the immediate underlying and basic causes of malnutrition. By the way, before anything else, I would like to introduce myself. Ako pala si Retsebeth. You can call me Ching. I'm into nutrition in development for almost 3 decades na. But this time, I'm representing LAEX. This is our consultancy firm with my husband. Kasi kailangan mag-support good ang wife sa husband, no? And it's also timely because dili layo, no? Hindi malayo yung aming nature sa work. We're also into development, but I'm on nutrition and he's on the agriculture sector. At the same time, I'm currently connected with the National Nutrition Council. It's an attached agency of the Department of Health. I'm the regional head of the National Nutrition Council in Davao Region. Now, based on experience, I was able to handle different regions in Mindanao. I've been the OIC and PC in Caraga for 4 years. Then I also handled Region 12 in Soxargen as well as BARM. And recently, I'm based in Davao Region na. So given those experiences, many, of course, learnings were generated with different contexts, particularly in cultural, environmental aspect, as well as on governance on nutrition. Now, this afternoon, I'm going to present topic on Philippine Nutrition Development Framework. Now, with the theme, Working Together, Growing Stronger, a collaboration path to nutrition and development. So last night, we've heard a lot about the importance of collaboration, about the importance of the community that needs to be established. No, that we are the stewards, and the importance and the essence of course, having this community, Christian community, wherein we could collaborate and establish partnership in order to reach out and be a steward of course, yung God's desire, to unite everyone and also to feel His abundance and His goodness. And I believe that this nutrition aspect is one of the areas where we could touch lives. Wherever you are this time, I know that you can do so much in touching individuals' lives, in touching the community on nutrition, okay? Because it can be integrated in whatever fields you are in. Okay, next slide, please. Now, let me talk briefly about the Lakihon Agro-Environmental Consultancy Services. This firm is composed of the different experts on agriculture, focusing on sustainable agriculture development, working with various groups, which includes the CBOs, which includes mga government and non-government organization as well as private companies, focusing on the agri-production, particularly on cacao, on coffee, and also on the concepts of farm planning and decision-making and any other aspects on sustainable development. Okay? Also, LAEX envision to uplift the lives of our farmers by promoting technologies on sustainable agriculture, integrated farming system, and elevating community nutrition and encouraging families as farming as a family business. with the mission to amplify the work of God in serving humanity through the team of dedicated workers, God-fearing development consultants and workers, with the goal to lead in rural development work by utilizing modern technology for sustainable agriculture, of course, preserving the environment as well as creating a healthy community, family in the community. Next, please. So, core services include sustainable agricultural training, technical consultancy, project management and evaluation, digital farming solution, environmental stewardship programs, and the organizational development. Of course, that also includes community nutrition and public health. LAEX works with the development partners, which includes UNICEF, USAID, NGOs and private sectors, as well as non-government agencies like TESDA, okay, the Department of Agrarian Reform, the Department of Agriculture, also National Nutrition Council, and also engage in broadcasting in promoting agri-technology through the XFE and the XKI. Next slide, please. Now, well, going back to my topic, okay, as I've said earlier, we are being reminded with this text on Psalm 139:14. I praise you because I am fearfully and wonderfully made. Marvelous are your works. So, it means to say, God reminds us that we are created in His own image and likeness. That's why we need to be a good steward of ourselves. No, also need to be a steward to our brothers and sisters. So we are called not only to spiritual discipline, but also to physical stewardship. So whatever field we are in right now, of course, we need to be reminded that we are not only looking after ourselves, but we are also tasked to look at the welfare of our brothers and sisters. Because as what Pastor Tan said earlier, we need to be a steward of God's love. Okay? And by doing so, we are already manifesting the love of God through our brothers and sisters. So when we nourish our bodies with wholesome food, we strengthen our capacity to serve, to worship, and to fulfill our calling with vigor and clarity. So again, so we need to be conscious of what we eat. We need to be mindful with what we eat, because the moment we got sick, how can we be able to minister? No, how can we be able to reach out or even be a God's instrument in His ministries? And that also has something to do with the people that we are reaching out, the target beneficiaries, the individuals that we are serving, and the community that we are serving. Next slide, please. So, the question is, how can we move our compassion beyond prayer into consistent practical action to fight hunger and malnutrition? Okay, so we are aware that the challenges on malnutrition is prevalent, not only in the Philippines, but it cut across Asian countries or Southeast Asian countries, and it's a global problem actually. But in the country, in the Philippines, we have a different forms of malnutrition that affects the general population, mostly on undernutrition. But in countries like USA, Europe, they don't suffer this type of problem that they more experience overnutrition. Okay, so let's talk more about that. So again, how can we move our compassion even if we have the heart to serve? But how can we be effective, and how can we put it into action? Okay, and how could we be able to fight malnutrition with that, the kind of service that we are in right now? Next slide, please. So let's take a look with the nutrition situation globally. Okay, worldwide or globally, malnutrition is existing rather. Okay, as you can see, an average of 1 in 3 people suffer from all forms of malnutrition, particularly on undernutrition. And that's equivalent to 667 million of children, particularly under 0 to 5 years old, who are classified as stunted. So under 5 children, they are vulnerable because they're very much dependent with their caregivers. They're very much dependent with their parents. So how they are being fed, how they are being cared for, totally depend to their parents or caregivers. And yet, majority of our under 5 children experiences undernutrition. So the 667 million could be distributed to problem on stunting, meaning to say the child is short in accordance to his or her height for age. So there are a total of 149 million children who are classified as stunted. And this is considered as a chronic form of malnutrition, meaning to say it's irreversible and it totally affects the growth and development of the child. It's a long-term form of malnutrition. Possibly, the child was already malnourished during the time that he or she was conceived, or during the gestation period, the child is already classified as undernourished. Then, 40 million accounts for overnutrition. Okay. We are experiencing the problem of undernutrition and overnutrition. So we call that the double burden of malnutrition. The moment that the moment that in the family there are cases of undernutrition and overnutrition, that could mean that these families experiences the double burden of malnutrition. And it's obvious, no? It's evident everywhere, particularly in the third world country, not only at the households level, but in the community level. There are cases of undernutrition, cases of overnutrition. Then aside from that, 49 million were classified as wasted. Wasted is a form of acute malnutrition. Okay? Now, unlike chronic malnutrition like stunting, acute malnourished children, most of them can be addressed through proper nutrition. Okay? So say for example, if the child experiences infection, okay, few days or few weeks by the time he got infection, possible that his weight is affected. So he will then be classified as wasted. But if we're going to introduce interventions like supplementary feeding program, say for example 120 days, okay, we could be ensured that the child will gain his nutritional status to normal, unlike chronic form of malnutrition which is irreversible. But then wasting is a very sensitive form of nutrition indicator. That's why during emergency situation, we focus more on addressing children who are already classified as wasted because of their vulnerability, and they're also prone to infection, and that might lead to death. Then aside from that, out of a world population of 7 billion, about 2 billion people suffer from micronutrient deficiencies. The micronutrient deficiency is a form of hidden hunger. Okay? You can see me as a normal individual, but possible that that individual is deficient in vitamin A, deficient in iron, deficient in calcium. So you can consider that particular individual as normal physically, but we cannot, of course, no, we cannot totally say that he's fit, healthy and nutritionally fit, unless we could be able to assess further his nutrition condition, because there are individuals who are suffering from micronutrient deficiencies, and most of these deficiencies are prone to children who are already classified as malnourished. Then there's also a problem on calorie deficiencies. Most of these are our elderlies, no? They're classified as chronic energy deficient individuals because most of the elderlies, there's a manifestation that they can no longer consume food that being consumed by a typical adult because of their health conditions. So there are several restrictions. So out of 5 billion adults worldwide, 2 billion are overweight or obese, and 400 million has type 2 diabetes. So globally, again, we have the problem of both undernutrition, overnutrition, and micronutrient deficiencies. And perhaps in your countries or in the country where you came from, I guess that same problems are existing but in different magnitude and nutrition classification. Next slide, please. Okay, so to assess further, ayan. So to assess further the nutrition situation, in the Philippines, we have these forms of malnutrition that affects all ages across all levels. So meaning to say, malnutrition affects the pregnant, lactating, infants, school children, adults, and even elderlies. In the slides, next please, you can see there that while the trending of malnutrition is going down, but if we take a look at per nutrition indicators, the percent prevalence rate is still considered as moderate to high based on WHO cut-off values. In fact, the problem on nutritionally at-risk pregnant women is alarming. Okay? So if you've heard the first 1,000 days of life, anyone from this room have heard the first 1,000 days of life? Those are nutrition strategies that caters of course, pregnant women and lactating women. If we want to address malnutrition, we need to address malnutrition during gestation or even prior to pregnancy, because a malnourished pregnant mother has a high risk of delivering a low birth weight babies. And in the Philippine data, the last survey conducted by the Food and Nutrition Research Institute, we already have 16% problem on nutritionally at risk pregnant women prevalence rate, and that didn't include rather the teenage pregnancy among adolescents. Actually, teenage pregnancy in the country is increasing, and that posed an alarm in the health and nutrition sector because, of course, we believe that the adolescents, no, they are vulnerable because they're still developing, and at the same time, they're already pregnant at a young age. So we're also looking at their nutrition condition. In fact, there are a total of 22.3% adolescents who are classified as chronic energy deficient. And of course, if some of them will get pregnant at an early age, then the vulnerability will be more high. Okay. Then, as you can see, the green arrow show the downward trending of the prevalence of malnutrition. This is a Philippine setting. But what alarms us, or what's is challenging, is the problem on overnutrition. While the percent prevalence rate is negligible in some age group, but then the trend is increasing. So what's the effects and consequences of overnutrition? Of course, it will lead to non-communicable diseases. At an early age, the child can have symptoms on hypertension, atherosclerosis, diabetes mellitus, no? Okay, those are forms of dietary-related nutrition condition. And even the trending or even the percent prevalence rate is classified as low to very low, but then the trend is increasing. And most of this are in the adult age group, wherein average of 31% of the adult and older adult are classified as overweight. And overnutrition is also high among lactating and pregnant mothers. Okay, next slide please. So here's the equivalent percent prevalence rate per age group. So in the Philippines, we're not only experiencing the problem on undernutrition, overnutrition, and micronutrient deficiencies, but we're also experiencing the problem of food insecure households, wherein 35.4% of households in the country are classified as moderate to severely food insecure. So this also was confirmed earlier by Doc Tan na after pandemic period, 60%, approximately 60% of the individual suffers hunger and food insecurity. And again, prolonged food insecurity will lead to malnutrition. That's why we're also looking into the cases or households classified as food insecure because there's a possibility of having a malnourished children if left not addressed or if being taken for granted yung kanilang nutrition condition. Next slide, please. So what's the effect of malnutrition in the child's development? Okay, when a child is malnourished, it will greatly affect his mental development. And as you can see, this slide will show us the two types of brain. That on the left side, this is the sample of a brain of a malnourished child who experienced chronic malnutrition. On the other side is the sample of the brain of a healthy child. So notice the difference. The brain cells of a healthy child is fully developed. No? The tissues, the cells are fully developed because the development of the child are fully dependent on the nourishment from the food that they've consumed or from the breast milk of the mother. Then take a look with the other side. As we can see, it's the brain cells are shrinking and it's not fully developed. And what's alarming is that part of the brain that are mostly affected when the child is chronic malnourished is part of the brain that's responsible for comprehension. So when you ask the child to buy a salt, okay, a few minutes later, he will forget, what was it, Mom? What did you ask me for? So something like that, because his brain is not processing well. The information that the child generates, the processing of the information is very slow compared to the well-nourished child. That's why we're really concerned with malnutrition, especially in the early years, because the growth spurt happens in the first 3 years of life. If the child is deprived or if the child is considered as low birth weight or undernourished, then somehow it will affect his brain development. Okay, so this slide will show us the conceptual framework or the causal framework of malnutrition as this was also illustrated by UNICEF. Okay, so what really causes malnutrition? We have classified it as immediate, underlying, and basic aspects. So the maternal and child undernutrition happens when there's inadequate food intake and if there's presence of infection and diseases. So if this is not addressed, then it will result to malnutrition. And how about the underlying causes of malnutrition? What causes inadequacy of food intake? It's due to poor food access, poor availability of food supply. It could be attributed to poor stability of food supply. And what causes that? It could be due to low family income. It could be attributed to poverty or limited knowledge on basic households, food production, something like that. Or if there's presence of inadequate care in the households wherein the mother has limited knowledge on child caring practices, or the mother is not practicing exclusive breastfeeding, or there's a late introduction of complementary food, then it will result to inadequacy of food intake. Okay, and it will result to malnutrition. Another aspect is on presence of diseases. So this could be attributed to poor wash or poor health and sanitation due to poor access to potable water supply or low access to sanitary toilet facilities. And aside from that, if the mother health-seeking behavior is poor, then they could not avail, or the child will be deprived with the basic health and nutrition services in the facility, which includes immunization, micronutrient supplementation, among others. Then, so why this existed? The underlying causes of malnutrition, why does it existed? It could be attributed to the basic causes of malnutrition, which could be political in nature. If the the recent administration's priority is more on infrastructure, less on social development, then that could mean that there's limited social and health and nutrition services. Or it could be due to cultural aspects. So there are some cultural beliefs and traditions that hampers the provision of adequate nutrition in the households and in the community. Okay? So specifically, if there are some presence of IP communities wherein the practice of early marriage is still high, or the early introduction of complementary food is evident, then of course that will lead to malnutrition, and that's more on the cultural. It could also be due to the social aspect, the environmental aspect, as well as if there are natural aspect like emergency situation, like presence of typhoon, or the community experiences calamities, and that causes displacement of the households, and that's where access of the basic services will be very limited, or will be limited. Okay, so to deepen the analysis on what causes malnutrition, okay, these are the identified causes, but in Philippine setting, okay, we identify this as another factors to malnutrition. And this includes lack of farm-to-market roads. Okay, why? Because if the road condition is poor, the mobilization of the food supply from the upland area will be very limited and very difficult, and that will add cost to transport the goods, the products from the upland to the area. And aside from that, okay, we can no longer be assured of a fresh commodities because of the poor road condition. Then poor irrigation will result to poor rice production, lack of food intake. Then mothers' attitudes and behaviors also is one of the factors, especially if the mother has a limited knowledge, or the mother is not attentive to the child's needs. Then what else? Big family size. So with that, it could be attributed to limited supply. So if there's a limited food supply, the distribution of food within the households could also be limited, and that will lead to food insecurity, or limited food intake due to low food access. Then illness of mother or family head, lack of job opportunities. So if there's no employment, then no income or limited income. If there's a limited income, there will be limited access to food. Then what else? We have the lack of political support, low capacity of workers, very expensive fruits and vegetables, vices of parents, low educational attainment, and the other factors could also be the ratio of the health and nutrition workers in the community, okay, which is evident also in the country, wherein we have limited nutrition practitioners and also health workers in the field to cater the growing population. Next slide, please. So, who's our enemy? Of course, malnutrition, because if malnutrition will exist, it will deprive the child's total development. And the long-term impact could be low productivity when they become adult, low immunity, and low work capacity. In terms of economic impact, okay, so unproductive workforce due to stunting will earn less compared to normal adult. And also, there's a study that the malnutrition could also affect economy, because of economic losses. And there was a survey that 3% of GDP estimated annual economic losses, and that's comparable to the damage of the areas affected in Typhoon Yolanda. And what else? Of course, we will miss the impact of achieving our sustainable development goal, particularly SDG number 2 on zero hunger, SDG number 1 on poverty, SDG number 3 on health, SDG 10, and also SDG 8. So we will miss in achieving these SDGs if we will not be able to address malnutrition. So based on the Lancet on the maternal and child nutrition, okay, we have several strategies to address malnutrition, and this includes the implementation of integrated intervention classified as nutrition-specific, nutrition-sensitive, and enabling mechanisms. So we will discuss more in details about these strategies that can be implemented to address the immediate, underlying, and basic causes of malnutrition. And according to Lancet, on maternal and child nutrition, if we will scale up the implementation of these integrated interventions, it will contribute to the achievement of higher impact, which is the reduction of morbidity and mortality, improvement of the cognitive development and social development, improvement of the school performance, okay, and of course, prevention of overweight and obesity, and it will improve also work capacity and productivity. So what are these interventions? Okay, again, based on the Lancet on maternal and child health nutrition, the implementation of nutrition-specific interventions shall address the immediate factors of malnutrition, which are purely due to inadequate food intake, okay, poor feeding practices, and also the presence of infection. So if we implement integrated interventions, which includes maternal and child nutrition, dietary supplementation or micronutrient supplementation, promotion of optimum breastfeeding, meaning to say, upon birth, 1 hour upon birth, we need to breastfeed the child so that the child can obtain the colostrum, that's a yellowish substance, first fluid that comes out from the milk of the mother or the breast of the mother, which are rich in sources of vitamins and minerals, and also has a immunity factor that protects the child from infection. Okay, so the practice of exclusive breastfeeding in the Philippines, we promote the practice of exclusive breastfeeding 1 hour after birth up to age 6 months of life. No other food should be given, no other fluid should be given, only breast milk. By the time the child reaches 6 months, then they can be given complementary food. The timely introduction and quantity as well as type of food given to an infant at the age of 6 months while continuing breastfeeding will save the child's life from death and sickness, and specifically malnutrition. Okay? Then also, micronutrient supplementation in the form of vitamin A, iron, calcium supplementation, zinc supplementation, because these are known to be deficient in some individuals, specifically, rather, those infants and children who are vulnerable to malnutrition, and the treatment of acute malnutrition. So we have this program, Integrated Management of Acute Malnutrition. These are children who are classified as severely acute malnourished and moderately acute malnourished. And there are specific interventions and strategies to manage these cases. Then disease prevention and management as well as nutrition in emergencies are also included in nutrition-specific interventions, because malnutrition in itself is already a form of emergencies. Okay, not only addressing malnutrition or nutrition during calamity, but the fact that malnourished or malnutrition already existed, and we could classify that as an emergency. Okay. Now, how about the classification of interventions per age group? So to discuss further in details the specific interventions, we could classify the following. For pregnant mothers, Okay, the following are the critical interventions, no, not only for the pregnant mothers, but as well as the infants and also older children. So there are 10 critical interventions as per Lancet on maternal and child nutrition. There are 10 critical interventions required, no, that should be given to pregnant, lactating, and infants. And if this will be scaled up by 90%, then we could be able to achieve reduction of malnutrition or prevent malnutrition. So what are they? Optimal maternal nutrition during pregnancy. A pregnant mother should receive a multiple micronutrient supplementation. And this includes iron supplementation with folic, and this could also include calcium supplementation, especially to mothers at risk of low intake. Then, for those mothers, pregnant mothers who are classified as nutritionally at risk or wasted pregnant mothers, they can be given or they can be enrolled in a dietary supplementation feeding program. In the Philippines, as per guidelines, we covered 90 days in the dietary supplementation. Okay, usually targeting those in the last trimester of pregnancy, because there was a survey that when we introduced complementary food to augment the nutritional requirement of a pregnant mother, we could be able to save the infant during birth from being a low birth weight. Okay. So 90 days feeding, and then also the universal salt iodization, because there are still cases of iodine deficiency disorder. So salt iodization is a form of food fortification wherein we added micronutrient iodine in salt, so that that's fortified with iodine, salt fortified with iodine. So those are the recommended interventions. And how about the infants? For infant and young child feeding, particularly 0 to 6 months, the promotion of early exclusive breastfeeding for 6 months while continuing breastfeeding as long as the mother has milk, has still milk, okay, 24 months or beyond. Then appropriate complementary feeding, education in food secure population, and additional complementary food supplements in food secure population. So not just basic complementary food, but diet diversified complementary food should be given to the infant in order to generate the different nutrients from the different food sources. But then again, based on the research conducted by the Food and Nutrition Research Institute, complementary food given to infants are not diet diversified. So that's again another challenge for us because of limited food sources and limited food supply, which hinders the provision of diversified diet or diversified complementary food for infant. Then micronutrient supplementation in children at risk. Okay, vitamin A, which includes vitamin A supplementation, usually given in 2 doses for the 6 to 59 months, and also zinc supplementation between 12 to 59 months. Then another thing is the management of acute malnutrition, which includes supplementary feeding program for moderate acute malnourished children and therapeutic feeding for severely acute malnourished children. So by the way, what's the difference between acute malnourished children and stunted children? The acute malnourished children, they are the children who are severely malnourished or moderately malnourished, and most of them are wasted, no? They could be protein energy malnourished, and unlike stunting, okay, the child is stunted or short in accordance to his or her age per height. So ayan po. Now, again, as per Lancet, if we scale up or if we put huge investment or scale up the coverage in the implementation of those interventions, those 10 critical interventions, we could be able to save lives. Okay, so for optimal maternal nutrition during pregnancy, at least 102,000 lives will be saved. and that will cost $571 cost per life year saved. For infant and young child feeding, 221,000 or equivalent to $175 cost per life year saved. For micronutrient supplementation, at least 145,000 lives will be saved or equivalent to $159, and the management of acute malnutrition, 435,000 or equivalent to $125 lives will be saved through this strategic intervention. So we have several interventions, but if our resources is limited, if our capacity is limited, then we could focus on this intervention because the Lancet showed, no, it's an evidence-based intervention and strategic intervention which manifests the child's of course, no, the child who are malnourished will be addressed through those identified strategies. Okay. So again, what are the potential impact of scaling up for continued investment in the implementation of integrated nutrition-specific interventions? We could save an estimated of 900 lives if those 10 critical interventions will be implemented, or if we scale it up to 90%, 900,000 lives in 34 high-burden countries will be saved, and reduce the number of children with stunted growth and development by 30 million. So that's high impact, no? If each of us will focus in addressing malnutrition through these strategies, we could be able somehow to contribute to the reduction of the global problem of malnutrition. So I hope that given this presentation, we will be enlightened and we will be, of course, we will be convinced not to invest for nutrition. So again, what's the cost of inaction if you will not do something about addressing malnutrition? What will be the impact? So equivalent to 48 billion in productivity could be lost due to stunting by 2030 if we will not do something about addressing malnutrition. Or $1 billion in productivity losses can be avoided annually by achieving the World Health Assembly target on low birth weight. Or $360 million is spent annually on breast milk substitute if we will just leave it that way, no, without addressing the infant and young child nutrition. If you will not strengthen the campaign on breastfeeding, then the mother will opt to giving milk substitute. Then 5,000 child deaths per year can be attributed to suboptimal breastfeeding, and 1,400 maternal deaths per year can be attributed to suboptimal breastfeeding, as well as 5.2 million IQ points are lost per year to low birth weight, and that's based on the Nutrition International. Okay, so nutrition-sensitive interventions. So these are the integrated interventions that addresses underlying and basic causes of malnutrition. So when we say food production program, that could also mean that it's another type of nutrition intervention that will address the underlying causes of malnutrition. So there are different nutrition-sensitive interventions that can be tapped, and this includes interventions through agriculture and food security to address food inadequacy, the early child development for early learning stimulation, the women's empowerment, the capacity building that can be given to women to increase nutrition literacy, and also positive behavior change. Of course, schooling, health and family planning services, maternal mental health, child protection, and as well as WASH. So these are the nutrition-sensitive intervention. And according to study, stunting can be addressed if we address the issues that affect stunting, or if we could be able to address the underlying causes of malnutrition on stunting through implementation of those intervention, nutrition-sensitive intervention, most likely we could be able to address stunting. Okay, meaning to say the the specific interventions, those are already regular services given by the health facility. But when it comes to the nutrition-sensitive interventions, these are not fully mobilized. These interventions are not fully maximized and aligned to address the underlying causes of malnutrition. So it means to say that if we focus on implementing or strengthen the implementation of those nutrition-sensitive intervention, we could be able to address stunting. And stunting, okay, if it's being addressed, there's a possibility that it will contribute to economic development. So evidence review of programs from 4 sectors. So these are the areas that needs also to be looked into to address the problem on chronic malnutrition, on agriculture, social safety nets, ECCD or early child development, schooling, and it's selected based on the relevance for nutrition, the availability of evaluation of the impact on nutrition, the high coverage of the poor, as well as the programs that could be targeted to reach nutritionally vulnerable. So this time, let me walk you through with the Philippine strategies in addressing malnutrition. We call this the Philippine Plan of Action for Nutrition. So this is the blueprint of addressing malnutrition in the country. Every 5 years, we update this plan based on the result of the Food and Nutrition Research Institute. Next slide, please. Okay, so as you can see, every 5 years we update this blueprint or we update this strategic plan. But this current plan is an integral component of the Philippine Development Plan, and the feature of this plan is in accordance to life stages approach. Next, please. And it's aligned by addressing food security and obesity, and it recognizes the importance of improving positive behavior for nutrition improvement. So this is strategic, multi-sectoral, and multi-level. And let me introduce to you the framework of the Philippine Plan of Action for Nutrition, wherein malnutrition could be addressed through these strategies. So if we strengthen the implementation of the three pillars on healthier diet, okay, better practices, and improve access to quality services, it will contribute to reduction of all forms of malnutrition. Now, the implementation of these desired outcomes could be attributed to the following strategies: by strengthening the implementation of the food system on food availability, accessibility, stability, and utilization. Okay, the campaign on positive social behavior change and ensuring efficient access to quality services. And of course, these are the enabling mechanism that will be established, the strengthening of the info system, nutrition info system, for target setting and program development, as well as monitoring and evaluation system, capacity building to the health and nutrition workers across all levels, the governance structures. Of course, no, this is very important because the local government units in the country are already devolved, so the management of their nutrition situation will rely mostly at their level, and of course, the financing. So if those are in place, it will contribute to higher impact, which is the achievement of the Philippine Development Plan objective, as well as the achievement of the Ambition Natin 2040 and the SDG. So the following are the objectives to in PPAN. It will cover addressing malnutrition, both undernutrition, micronutrient deficiencies, poor infant feeding practices, food insecurity, and overnutrition. So these are the goals and objectives of PPAN. And the following are the guiding principles. It's equity and social justice. It's based on sustainability, and it follows the evidence-based strategies. And it also promotes multi-sectoral and multi-level collaboration, and also community participation, and promotes the rights on good nutrition. Next, please. So these are just some of the examples of the nutrition interventions implemented in the country in according to the pillars. On the pillar of healthier diets, we have these following interventions, not only limited to households and community food production, but it also includes dietary supplementation, the food stamps or cash transfers, the food fortification program, the Philippine Milk Code, okay, the regulation of unhealthy food beverages, as well as the marketing of fresh foods from the farm, no, to shorten the path from the farmer's level to the consumer's level through Kadiwa. For better practices, we have these following strategies: the maternal health service package, including the campaign on breastfeeding and complementary feeding. Okay, it also includes the campaign on the first 1,000 days of life and the social behavior change campaign across all age group. And for improved access to quality services, it focuses on the delivery of efficient and effective services for infant and maternal, as well as enhancement of the learning institution, the family development session, adolescent health and development program, and the management of acute malnutrition among elderlies. Okay, so, and also the following enabling mechanism includes, okay, focusing on governance structure for coordination and implementation, because we cannot resolve, or we cannot solve malnutrition alone. We need multi-sectoral collaboration and coordination, because problem on food insecurity can be addressed by agriculture sector. Problem on social development could be addressed by the social development sector, and so on and so forth. And of course, the problem on health and health interventions or health issues could be addressed also by the health sectors. That's why we promote collaboration in the implementation of this PPAN. And programs that will be promoted and implemented will include WASH program, as well as it also includes developing the nutrition information system, because that's still one of the aspects that needs to be developed and enhanced, the nutrition information system. Since we are already digitalized, our Operation Timbang, we call that the mass weighing of our children. We already uses, okay, tool for efficient, accurate, and of course, no, ease of use, consolidation of our data on nutrition. Okay, next slide, please. So with that, given all those magnitude of malnutrition, okay, we also give emphasis on the first 1,000 days of life. Okay, what's the first 1,000 days of life? By focusing the intervention to the first 1,000 days of life. First 1,000 days of life includes pregnancy, infancy, up to 2 years old. So during pregnancy, that's equivalent to 9 months. 9 months is equivalent to 270 days. The first year of life of the child is 365 days, and the second year of life, another 365 days. So if we add it all, that's equivalent to 1,000 days. So meaning to say, next slide please, the first 1,000 days of life is considered as a golden window of opportunity. If we want to prevent, manage, and address malnutrition, we need to focus on the first 1,000 days of life. By the time the mother conceived, then we need to focus on the mother's nutritional needs. Okay, so another way of presenting the first 1,000 days of life, first 9 months pregnancy, 180 days or first 6 months of life, exclusive breastfeeding. Then the remaining days will be the introduction of complementary food while continuing breastfeeding. So this is another way of showing how we could be able to strengthen the campaign on good nutrition in the first 1,000 days of life. So again, it's considered as the golden window of opportunity. So if there's an avenue or opportunity for us to reach out to address malnutrition, then we could cater this age group if we want a preventive and more sustainable management of malnutrition. So because this is during this period that the health and nutrition concerns are, of course, very challenging. And why first 1,000 days of life? Because if we could not be able to address the nutrition concerns during these years, no, they will have less chances of survival due to poor nutrition, or of course it will affect we will miss the opportunity for optimal growth and development. Simply saying that. So during the first 1,000 days, again, because that's the period that the child's brain is develops, the progress of the development of the brain is fast. Then again, we also have another version of the critical intervention. Actually, just in the Philippines, we identified these critical interventions extracted from the Lancet. So according to WHO, if we scale up the implementation of this intervention by 90% by ensuring high coverage, high budget allocation, we could be able to address stunting by 20%. So they have a study on that. Okay, so our reference for this is the FHSIS. Those are the data sets by the health sector. Next slide, please. Conditions needed for a healthy child. The child needs food, feeding and care practices, health services, as well as wash. Okay, so we will just run it down due to time, time constraint. Okay, next please. So at the community level, these are the strategies that we can look into. Okay, the campaign and promotion of multi-sectoral engagement. Okay, it also promotes equity among families in the community and promote and preserve moral and social values if we address ECCD. Now, children who get the right nutrition in the first 1,000 days of life are 10 times more likely to overcome the most life-threatening of childhood diseases. So most likely, they will be spared from NCDs and also cases of mortality and morbidity. 4.6 more of grades in school will be complete. And in terms of productivity, they will earn 21% more. And of course, are more likely as adults to have healthier families. So again, why invest in nutrition? Why we need to invest in nutrition? Aside as we are being called for as the steward, no, to show God's love. But why there's a need to invest for nutrition? Next, please. Because by saving lives, no, by investing in nutrition, we can save lives, and it can boost gross national product by 11%. This is based on the experience of other countries like Africa and Asia. It will prevent child deaths by more than 1/3 per year. It will improve school attainment by at least 1 year. It will increase wages. It will reduce poverty. It will empower women. And the most important one is it will break the intergenerational cycle of poverty and malnutrition. So what can be done? Okay, what's the role of the different sectors from the national government agencies? These are the identified roles of the national government agencies to focus more on policy development in support to the implementation of nutrition programs. We need policies to support the implementation of our health and nutrition program, the strengthening of the structure on nutrition, the mobilization of the different stakeholders to generate resources, multi-sectoral collaboration, and the importance of monitoring and evaluation as data set, no, for policy, for program development, and also advocacy and communication. And how about the local government units? So this includes the provincial, city, municipal, and barangay level. Those are the units, no, the administrative level in the Philippine government. So the LGUs can focus on the following, again, on policy by localizing the national policies through ordinances and resolution, the implementation of integrated nutrition programs because the LGUs are already devolved and they have the capacity and capability to implement and invest in nutrition, nutrition education awareness campaign, M&E partnership collaboration, which includes the CBOs, the CSAs, the non-government organization, and private sector. So in the Philippine setting, if an NGO or private sector is working, no, have an existing program or project in a certain locality, they can engage with their local government unit because we have this structure on nutrition committee up to the barangay level, and it's composed of multi-sectoral body that integrates all those identified programs by the different sectors. So how about the NGOs and private sector? Again, the monitoring and evaluation is still there. The NGOs can, of course, extend support through capacity building because government resources are limited, and we need to generate support from our NGO partners for providing health and nutrition trainings to our frontliners, collaboration, CSR initiatives, fundraising activities. Of course, the recognition of innovative programs and best practices, and we also have the nutrition supplementation and emergency support. Okay, so these are the sample structure of the nutrition in the Philippine setting. We have at the national level, the National Nutrition Council. At the regional level, we have the Regional Nutrition Committee chaired by the Department of Health Director. At the provincial, city, and municipal level, we have the Nutrition Committee chaired by the local chief executive. And at the barangay level, we have the Barangay Nutrition Committee chaired by the barangay captain. Then, of course, the LGUs has this critical window to determine the development through nutrition. Next, please. Okay, so if the local government unit, next law, up to this path, then they will achieve positive outcome. But if they will go through this path, they will achieve negative outcomes. So what are they? Of course, if they will invest more on nutrition, they will achieve this. But if there's no action done on nutrition, then we'll expect this. And again, based on report, the Philippines is the second shortest in ASEAN, second to Indonesia. I don't know if it already changes this time, but few years back, we ranked second in the ASEAN countries as the shortest in the Asia, ninth in global stunting, and 4.6 million stunted children, 1 million wasted children. And of course, if we cannot be able to address this, it will lead to economic losses. Ayan. So I'll end my presentation with this question. Okay, we or you and us, no, we're all into development work, whatever field we are in. Okay, the question is, how can we be able to actively contribute to bridging nutrition and Christian ministry in ways that promote both physical health and spiritual growth? Because if there's good nutrition, then of course it will manifest, no, the God's abundance in our lives. Okay, our marginalized sector in the community will not be deprived with social services, and they will not be deprived with opportunities that are also generated by other individuals in the community. So, second question, what specific programs or initiatives could be developed to promote nutrition within your ministry or community outreach? Okay, so again, I hope that with this presentation, you were able to generate ideas how you could integrate, harmonize, and align your efforts by, of course, no, achieving positive nutrition outcomes. Because by simply conducting community organization, we can already, we can already integrate nutrition concept on that. So the perspective is that how are we going to integrate nutrition in whatever field we are in and in whatever services or programs that we are implementing in order to address the immediate underlying and basic causes of malnutrition. So again, these are some helpful ideas where we could extend support, but not only limited on this. Perhaps we could somehow support through feeding centers or support through school-based feeding with integration of Bible studies, or providing nutrition support for new mothers, especially the teenage pregnant mothers, with prayer and counseling, or promote on the campaign of vegetable gardening, because it will somehow support food access at the households level, particularly those who are classified as low-income families. Teaching believers about healthy food choices and mindful eating habits could also be one of the aspects. Health fairs and faith, or integrated with food seminar. So to end, when we reach out to the vulnerable, we reach out to Christ Himself. So Matthew 25:40. Thank you, everyone, and thank you for actively listening. And I hope that you were able to gain insights with this. And of course, no, we would also look forward for future collaboration with you if there's opportunities to, of course, to collaborate on this aspect. So, any question or clarification? Or you might want to share something about what you're doing in your community or in your country, and how did you align nutrition in your ministries? Anyone from the group? Okay. Anyone who wish to share? I guess, do we still have more time? There's none na. Overtime na. So if there's none, once again, thank you. You may reach us through this contact details. Okay, thank you. God bless everyone and good afternoon.